Hi, podcast listeners. I'm Rebecca McEnroy, and I have the great honor and pleasure to serve as the executive producer for See You Now. Even though the podcast is still in its infancy, we've already interviewed some of the most incredible healthcare innovators out there, and we're excited to hear and share more stories with you in coming seasons. And speaking of coming seasons, while we're busy preparing Season 3, we wanted to highlight some of our favorite moments from Season 2, just in case you might have missed them or just want to check them out again. And if you have any favorite episodes, please let us know at hello@seeyounowpodcast.com. We'd love to hear from you. And also, please let your friends know about the podcast. Your recommendation will help us grow, and so we can continue to share the stories, the ideas, the voices that aren't always noticed, but they are the voices that matter. Thank you. See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
Welcome to See You Now. I'm Shauna Butler. As we wrap up Season 2 and embark on our third season of See You Now, we're listening back through the stories and hearing important themes emerge that include a heightened appreciation for innovation, the role it's playing in responding to our current public health crises, and how that role is changing and evolving. In the era of COVID-19, the practice, permissions, and norms of innovation have been shifted dramatically. It's also identified and cultivated new leaders of innovation. Season 2 took us across the country, finding stories of health innovation from one coast to the other, from rural settings to urban settings, with nurses who specialize in everything, from intensive care to design to legislation. While the season highlighted the geographic differences, it also punctuated, possibly more importantly, just how much we share in common. We zoomed into Cleveland, Ohio, where we met nurse and designer Brittany Merkel, the lead innovation strategist on the UH Ventures team of University Hospitals. 3 months into her new role, COVID-19 forced her and the UH Ventures team, along with millions of others across the world, to work remotely, virtually, and differently. In addition to changing how and where she worked, this global pandemic also shifted how we view innovation and the role it plays in addressing new and unmet needs.
When things are stable, pre-COVID days, I would say roughly fairly stable, innovation is looked at to jigger it up, to destabilize, to detach from the ordinary. And ironically, when things are in chaos, innovation is looked to more for the insights, the solutions, and to turn the rain into silver. And we're playing the counter role in a lot of circumstances to our usual disruptor role within our health system.
COVID-19 not only changed the way we innovate, but it has also defied the prevailing notions surrounding innovation. That was clear in our conversation with Geisinger's Chief Health Innovation Officer, Karen Murphy, who gave the 30,000-foot view of enterprise-level innovation and described a scale and pace that was once thought of as too hard, too risky, and just not possible.
I always say that this job is the hardest one I ever had, because to fundamentally change the way we deliver healthcare is extremely difficult. And really, every time you came up with a solution, it was how hard it would be to execute because the system is so complex. Well, with COVID, what we were doing on March 16th came to a grinding halt on March 17th in ways that if you had said in January, this is what we're going to ask you to do, and do you think you can achieve it, healthcare industry, I think we all would have said no. And yet we did, and it has been a really tragic and challenging time. We pivoted 7,000 employees to work from home in 24 hours.
What, 7,000 in 24 hours?
Yep.
Wow.
Sent them home and said, you'll work from home. We redeployed 1,500. The experience was just myth-busting. we really have to take a look at this crisis and say that transformation on a big scale is possible.
Throughout all of season 2, certain themes started jumping out. The innovators we spoke with all shared how COVID-19 had given them a rare opportunity to work across disciplines with new teams and in new and novel ways, giving them unexpected gains from working with diverse skills and perspectives and experiences. Simone Hannah-Clark is one of the many thousands of nurses working in intensive care units across the globe. Calling upon a wide range of colleagues within her health system, she was able to meet the unusual circumstance of having to innovate in real time.
Having specialized teams to do certain tasks was really helpful and freed us up a lot in terms of the general patient care. I would love to see more of that. It was really wonderful to work with specialties that we don't normally get to work with. During the very intense weeks where we had peaked, we were working with nurses and physicians from all around the hospital from completely different specialties. We had chief surgeon from our hospital who they came and they were like, what can I do? And they would say to us, the nursing staff, these are surgeons at the top of their field, and they'll be like, we don't know what we're doing. This is completely not our specialty. Let us know how we can help you. And they couldn't help us enough. And they were incredible. We had nurses from all over the country, travel nurses. We had nurses from the floors at Mount Sinai who came, and they couldn't help us enough.
This type of collaboration was also evident in our conversation with Danielle Bastine, a nurse practitioner at Henry Ford Health System in Detroit, Michigan, and the innovator behind a human trafficking screening tool that's been successful in detecting victims and initiating their rescue process and road to recovery. Her work has been adopted and adapted throughout the U.S. and continues to influence and shape how we identify victims.
Where human trafficking is now is essentially where domestic violence was 30 years ago. I've shared my work with over 50 institutions, and that's all they needed. They call me and say, we've been working on this for 2 years. We never really quite got it. Can we use some of this stuff that you've done because we don't know how to move forward? And sometimes all you need is that template, because from the policy, then it snowballs. Then you've got a committee that's doing this. Then you've got an action plan if you have victims. Then you're going to start to look at what are our local resources. Okay, now there's gaps, right? What are the gaps in your community after you've identified the ones in your system, and then fill them? There's so many creative ways that we can kind of work around the system that we have, but then with what we learned, change it from the inside.
Policy as an act of health innovation rang loudly in our wide-ranging conversation with Delaware's Lieutenant Governor and public health nurse, Bethany Hall Wong. We discovered the vital connection linking clinical training and innovation skills to authoring, sponsoring, and passing legislation to keep our states, our citizens, our environment, and our economies healthy. And of course, she spoke about the power of voting and how nurses' participation in the political process leads to healthier communities and citizens.
Voting and health innovation are really important and related. Bad elected officials come from good citizens who choose not to vote. And we have to, particularly in healthcare and in nursing, with our oaths that we take and our social justice platforms and our social practice policies, we have to be involved. Nursing in and of itself, being in public policy roles, whether it be at a local level, a county level, a state legislative level, or like myself, statewide office, lieutenant governor, or even at the congressional level, that in and of itself is innovation. If you were to interview other nurses who are in policy roles, whether regulatory or elected office, they could also share with you how they've made a difference not only in the profession, but everyday lives of children and families across this great country. Because nurses have served in a policy-making capacity, that is innovation in and of itself.
Throughout all the See You Now conversations, season 2 and beyond, there is this fascination and intellectual thrill of seeing and solving a problem. Innovation is exciting, it's necessary, and it is powerful. But in each of these stories, what holds our attention is the humanity of each experience. Alongside and at the core of our advancements and breakthroughs, of the rigorous scientific inquiry and evidence-based practice, is caring for people and nurturing the human spirit. The very human, very raw, and very real. It is the emotional and dramatic experience that keeps us glued to the work, to the stories, to the lives of those we touch. And it is beautifully captured by ICU nurse Carlos Chochez.
It's difficult in itself when you are preparing a body, but during this pandemic, it's like, what more do we have to see? You know, and that's what was going on in my head. I felt so bad for this patient because I saw her transition. I saw when she came in, I saw where she was heading. There was one time I had so much hope for her. And then I come back and I'm with Simone, and I remember just standing there, trying to take it in. And it was so difficult. Like she said in her article, we do everything gently. I think one of the hardest things, though, is unfortunately these patients come in sometimes, they have their cell phones. This has happened to me multiple times where I'm preparing the body and I have to go through belongings. And the hardest thing to see is that their phone is still working and you have missed calls. And that just pushes me over. I have to stop at that point.
As this pandemic has exposed the inequities, disparities, and complexities in our healthcare system, it has also unleashed a pace and scale of innovation that has been the surprising silver lining of this public health crisis. A pace some of us never thought possible. Indeed, we can move swiftly. We can make monumental changes. When clinical outcomes and safety drive what we do, the business case for innovation grows stronger. Being proximate to the problem and moving the decision-making as close to it as possible has important benefits. Iteration and sharing what works and what doesn't work sustains the pace, enthusiasm, and diffusion of innovation. Coming up in Season 3, we'll continue to explore the vast and varied health innovation landscape, and we'll meet innovators at the forefront of disaster preparation and response. Innovators working with parents to make sure babies have the nutritional start and the social and emotional connections they need to thrive. And we'll take an in-depth look at the trailblazers improving Black maternal health, who are creating respectful care for all pregnant people. It's an exciting time to be a health innovator. The need is great, and the possibilities are endless. Join us as we continue to bring the stories of who and how today's most challenging moments are being met. For See You Now, I'm Shauna Butler. Stay tuned. We'll be back soon.
Subscribe to See You Now wherever you get podcasts. And please share the show on your social media or just tell your friends about it. Your recommendations make a huge difference. We'll be back soon. Thanks for listening. Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Learn more at seeyounowpodcast.com.